Hello there, I'm David Staples with the Edmonton Journal. And I'm here today with Keith Gerein of the Edmonton Journal. Welcome, Keith.
Hi, David. Hope you had a good weekend.
So far, so good. We're making the Easter turkey today, so we'll see how
Easter
that goes.
Monday family. Got it. Nice.
Yeah, well, it shifts back and forth. We're also having the Easter egg hunt, and my cat is going crazy chasing down the chocolates. Because the kids, their teenagers are still slumbering. So yes. Lots going on here, Keith. Yes. We're going to do today the top 10 tweets from Alberta and around the world. This is and I'm assembling this, so this is really my list, although you're free to, if you ever want to pick a tweet out yourself, go for it. And I'm trying to have a cross section of viewpoints from the tweets, just not from one side or the other. And I'm not saying who's right or wrong. That's not the purpose of this list that I'm posting every day. It's just to show where the world is at right now, as well as I can, and where Alberta's at. So Keith, let's start out. We're gonna go back and forth, read some tweets. What tweets caught your interest? What's your first one?
Yeah, there's quite a selection. So I'm going to start with a tweet from conservative commentator Norman Spector, who goes, at a certain point, Ottawa and the provinces will likely have to make a choice between lives and livelihoods if there's no vaccine. Don't envy them when that time comes.
Yeah, I thought that was an excellent thought. Okay, mine is from, this is on the lighter side, from journalist Victoria Brownworth. And she tweets, quote, it's after 11 p.m. and the wife is making chili and cornbread, unquote.
All right, my next one is from Justin Trudeau's associate, former aide, Gerald Butts. Oh, Gerald. He goes, the old joke is journalists wait until the battle is over, then come down from the hills to shoot the wounded. The new model seems to be, why wait? Let's shoot them in active duty. The clicks will be awesome.
This is in response to the criticism of Chief Medical Officer Theresa Tam that's going on right now from a number of quarters. And in response to that, one of the people he was directing that right at was the Globe and Mail's Robyn Urback. And because she had written some columns questioning Tam's handling of the face mask issue in particular. So she tweets in response to Butts, Robyn Urback, quote, since we are indeed in active duty, it's arguably even more important to evaluate and scrutinize how we got here. That's how we course correct, improvise, revise.
There we go. The next tweet I'm going to read is from actress and author Leah Remini. This speaks to a particular fear of mine. She goes, tried to put on pants today. Didn't go well. I wouldn't recommend it. Yes, some of my nursing friends are calling this the COVID-15, as in the 15 pounds we're all going to gain by the end of this.
I think, I've heard the COVID-19. Yeah, we all have to do the walk of shame on that one. Okay, this is from, this tweet is from, it's in response to golf courses being shut down in Alberta, and this is from Alberta social justice advocate Stacey at Blurg5, and she says, quote, whoever decided women were too emotional, obviously has never told a bunch of men that they can't play golf for one season. Unquote.
Have some golfing enthusiast friends that will, I think that's quite true for them as well. I'm going to go with a tweet from Stanford Epidemic Intelligence Service Officer, my goodness, Dr. Seema Yasmin. All these headlines about COVID-19 survivors being immune to reinfection must mean I missed the peer-reviewed papers demonstrating this. Please drop links to papers asserting survivors are immune. I think this is going to be an emerging issue as well. So.
Yeah, I'll just quickly say that the latest studies are quite indeterminate, and there's a concern that a large percentage of people don't have enough antibodies to prevent getting it again. But again, the science is really iffy on all of that.
Early days, very.
And this is from one paper that's come out recently, and so that's why this is coming up. Okay, my next one is in response to Alberta's gift of $41 million worth of medical equipment to other provinces. And Deputy Prime Minister Chyrstia Freeland says about that, quote, we are all in this together. Thank you, Jason Kenney and Alberta. In the days ahead, we will all need to lean on one another, and together we can overcome COVID-19. Hashtag Team Canada, unquote. And I felt a little emotional reading that. Good for her.
It's nice when we all get along. So, the last one I'm going to read here and comment on a bit. This comes from a U.S. National Public Radio correspondent, Karen Bates. And she goes, just heard an interview on 60 Minutes from a couple of psychologists who specialize in trauma. Each thinks the mental health needs after COVID-19 will be as challenging and more widespread than the virus itself. And this one spoke to me a little bit because it's similar to a column I did maybe a few weeks ago, kind of near the start of this, just about the mental health challenges that we're likely to face. And obviously there's challenges during the pandemic itself with people kind of knocked out of their normal routines. But there are longer term implications to that. And we saw that with Fort McMurray to a degree, that when people are knocked out of their normal routines, there are long term issues that come up. In this case, depression, substance abuse. There will be relationship issues that are currently playing out. Sometimes people hold it together during the crisis itself, but once it's over, they can no longer handle that. So divorce rates and so on. These are among some of the bigger problems that are going to happen. I think you're going to see people that become germaphobes in the future, right? How we handle going outside and our interactions with people, right? People could be affected that way. So this is going to be an interesting exercise to see how this plays out over the long term. We've got to get through the immediate crisis, but I am concerned about what happens in the months afterward.
Maybe the germaphobe part will be a little bit of a good thing, because maybe some people, we could have all, maybe, especially speaking for myself, done a bit more hand washing all along, and will be good for all of us. You know, Keith, I'm worried about, I think the long-term implications are there, but I also worry about the short-term implications, like all of us living, like we're all having, I think everyone's realizing, okay, I think there's probably a big spate of house cleaning going on across the world right now. I've been seeing that on Twitter, like people organizing things, and like we're in our houses, we have to make environments that are cleaner. But I'm also worried that people are going to get so frustrated with this, the conditions, that it might start just not economic pressure, but psychological pressure to get out of this maybe before it's wise to do so. And I don't have the answers I'm trying to figure it out like everyone else. When is it wise to start opening up again? But I think one of the things that might come is like, I got to get out there on the golf course. I'm going crazy. Like, I can't stand to be in this confined situation one more day. And that might start to driving a pretty important political decision, which, as Norman Spector says, that he doesn't envy any politician. And I think Spector, that nailed it. I don't envy Justin Trudeau, Donald Trump, Jason Kenney. It's going to be a provincial decision. And these people all have a very, very difficult decision to make. And I think that we have to give all of them some leeway in making this decision, and kind of on a certain level try to accept whatever decision that they make, like, push for the right decision, but back off a little bit, because this is going to be an extremely difficult thing. And in partisan times, it's hard to do, because we all have our favorite politician that we like to rag on and attack constantly online. But this is the hardest decision they may ever make. Getting this right, there's no right answer. Some countries like Denmark, Sweden, they're already moving towards opening things up. So fortunately, we're a little bit behind Europe and behind Asia, so we can see what works and doesn't work. But yeah, I'm worried that this frustration is going to come out in that regard and push politicians to move quicker than maybe is advisable.
Yeah, and I think I was going to say the economic pressure in particular, I think, is really going to grate on people. I mean, even today in Vancouver, one of your tweets was, a protest that's happened in Vancouver called in the lockdown, and I think it's happening elsewhere as well. And these are people who are deliberately flouting social distancing rules out on the street because they don't see a need for it at this point, because our cases haven't been out of control like we've seen in other countries. And so, yes, you're right. Where is the tipping point that says, okay, we've got this under control now, we can start opening things up? Because if you get that wrong, that obviously leads us potentially back into another need to lock things down. And so, yes, over time, more and more of that is going to get really, really frustrating for folks, and especially with the economic stress that people are under right now.
Yeah, I was trying to think, because we're all right now the conversation is dominated by a certain set of numbers, and those numbers are how many new cases and how many deaths. Like, we all know those numbers. We're all obsessed with those numbers, or many of us are. And I think in terms of opening up, we're going to need another set of numbers to start thinking about as the count. Like, and I think that those, and I'm just speculating here. I'm just throwing this out here. I'm not an expert, but those numbers may be, okay, what's our hospitalization rate compared to available hospital beds? What is our ICU numbers compared to ICU beds? How many people are going without pretty important procedures right now as we wait, medical procedures, as we wait for all this, and how do we weigh that against the perceived need? Because it is true, there's a lot of hospitals that aren't busy right now because you can't get busy with elective stuff, non-essential stuff, because you might have a real crisis.
Yep.
So, and the third number might be in terms of like total identified cases, percentage of those that are found to be positive for COVID-19. What is that? I think it's about 2% right now, maybe going down. What can we handle going forward? What infection rate can we handle going forward? So that's something like we'll watch. If it goes up to 3 or 4%, maybe we're going to have to shut down things again. But we start to see that declining, if we do a ton of testing, maybe that will be one of the numbers that we look at and say, okay, it's okay now to open up a few things.
Yeah.
My final tweet is in response to the Alberta gift, again, of $41 million of medical supplies, and it's from a social justice activist, Rob Urback, here in Alberta, and he's pretty skeptical about the motives behind this, and he says, quote, "Like a gangster, Jason Kenney holds favor to other provinces and Justin Trudeau to bail out oil. UCP scum uses a pandemic for gains. I'm grossed out and ashamed as an Albertan. My fellow Canadians, I am so sorry. This should be a gift with no, I'm so sorry. This should be a gift with no strings attached," unquote. And, it's an interesting comment. I agree with part of it. I don't agree with the sentiment at all, but I think it was really important that Kenney framed this as a gift with no strings attached. That's how I saw the framing of this. I thought he tried to make that clear, that's what it was. And I think it's important going forward that he maintain that he not bring it up himself, that the leader of the province and other people in his government on the oil issue and other things they shouldn't say, hey, we stood up for you, now it's your turn. Because he framed it that way, the correct way initially, he's got a hold to that. And it was actually fantastic that he framed it as a gift, and they're not expecting payback. That's what he should have done. He did it. So he's got to stick to that. And I would say at this point, until he does that, let's give him the benefit of the doubt and say, good for you. You did the right thing, and leave it there at this point. I don't think there's any need for that kind of commentary that this is just some evil plot to get pipelines built. I mean, in a federation, we do need people to work together. There's no doubt about that in a confederation. But until he actually makes that the quid pro quo, he hasn't done that. So I think people need to back off.
Yeah, and one of the tweets you read earlier from Chyrstia Freeland, right, who represents a government that the Kenney government has been kind of in a war with for quite some time. She certainly phrased it as a thank you, as she saw it as a gift, not as a political tool or bargaining chip. So let's try to take it on that level as well. And I agree with you. We'll watch the messaging from the Premier further on about this. But at this point, I agree. I think it's important to give the benefit of the doubt and believe that this was given in the right respect, in the right motivation.
Our politicians here are acting like the adults in the room, so I think it's incumbent upon us, upon such a interesting occasion, to definitely follow their lead. Another criticism I heard was, well, why are they doing it now? Like, earlier in the week, weren't they saying they only had a month's supply of the masks? Well, and I'll tell you my understanding, because I interviewed JP Prasad, who's in charge of the program. And Keith, I want to give a shout out to you, because you were the first journalist who, in early February, you looked into Alberta's supply situation, and you wrote a column digging into the Alberta stockpile and explaining it to people, and so that was well done. Now, JP Prasad, what he said was, they chartered an airplane. They chartered airplanes from China to bring in supplies. And a huge shipment was coming in. And when I talked to JP earlier this week, he didn't know if that was coming in or not. Like you do all the right things, but he didn't know. And I haven't confirmed this with him, but my assumption here is that when they knew that that huge shipment of supplies was in the air from China, that freed up Kenny at that point to make this announcement. I think that might be related to the timing, because that plane was coming in on Sunday to Alberta. That's when it was supposed to come in yesterday. And Kenny's announcement comes Saturday. So again, this is some I will call it informed speculation on my part. They were waiting for this to come in, and I'm guessing that it's coming in now. Planes in the air. Okay, we can make this announcement because we're safe. We're good to go in Alberta. We're covered. I don't see any way that the Alberta government would make this gift if we weren't covered in Alberta.
Yeah, you would hope. Yeah, I think that's good logic on your part, and hopefully the plane arrived and did contain what they think it contains. And you're never
all in good
entirely
working order.
But, yes, exactly. So, but yeah, I think your logic's pretty sound there.
You know, one other thing Prasad said was, it was interesting because there's a lot of criticism of China, and I've been doing it myself. You know, many of us are mad at China. But he said one of the holdups in the supply line was the Chinese government was worried about bad equipment being shipped out. So they have all these manufacturers. They're trying to maintain quality control. They don't want China to have a bad name either. So one of the things is, but they need to have people inspect all this stuff before it was being shipped out. And that's one of the things that was holding up shipments from China. So there you go. Things are more complicated sometimes than we would like to believe. But sometimes the bad guys are good guys and the other way around.
Yes. Occasionally that's true. Not always shades of gray.
So Keith, thanks for talking today.
It was great.
And I would like to, we will. And I'd like to thank everyone for listening. Talk to you later. Just gonna shut.